How to practice in Netherlands or Holland after your BDS in India. In today's video, we are going to answer that question. If you're interested, stay tuned. Hi, I'm Dr. Satish Kumar and this is Kaizen Dental. Our aim here is to help dentists succeed. To practice in Netherlands, you have to have your name in the Dutch Healthcare Professionals Register. This is managed by an organization known as BIG. So it's known as the BIG Register. To get your name entered in the BIG Register, as a non-European Economic Area dentist, you need a competence certificate, and that certificate is given by the BIG administration. For that, you have to give 2 examinations. The first test is known as the General Knowledge and Skills Test, or the AKV Test. The test comprises of 3 parts. The first part is to test whether you are competent enough in the Dutch language. So your Dutch level language has to be at least B2 to C1. The second part is based on your English language skill set. Again, your English language skill set should be at least B2 or C1 level. That is, if you see in IELTS terms, it should be at least 6.5, and in TOEFL level, it has to be 600. The third part of the examination is to test whether you understand the healthcare system of Netherlands. So you will be asked questions about legislation, ethics, and the organization out there. Before I move on to the second test which you need to give, I would request you to hit the like button below, because we put a lot of effort to come up with this content, and I'm sure you're already subscribed to our channel. There are few of you who have told they're subscribed but are not getting notifications. The reason is you have to hit the bell icon so that whenever we post a video, you'll be updated about it. The second examination, once you clear your AKV examination, is known as the Professional Test or the BI exam. It has 4 parts. First, your theoretical exam, then your preclinical exam, followed by a case history examination, and then diagnosis and treatment planning. The theoretical examination has 4 parts. First is your basic medical exam, then your dental knowledge exam part 1 and 2, and then a question paper on radiology as well. Then comes your preclinical examination. In that you have to do procedures on phantom heads, which include scaling, crown cutting or crown preparations for bridge. You'll have to do an endodontic procedure on a tooth, as well as cavity excavation and restoration of a given tooth. In the third part, you will have an actor who would come and give you his case history. You will have to take the entire case history and write it down. This is to judge whether you are competent enough in the language in terms of taking a case history of a patient. In the fourth part, you will be given 3 different cases, maybe radiographs along with it or photographs, and you would be asked to give a diagnosis which you think is suitable and the various treatment plan options available. Before you go and find your job, there's one more step remaining. You are not allowed to shoot radiographs in Netherlands even after clearing these examinations. To do that, you will have to do a separate course on radiology out there. Once you do that, you're completely ready and can apply in clinics out there. One thing you'll be wondering is I haven't mentioned the cost in the entire procedure. The reason is, based on the pandemic situation as of now, they have stopped all these examinations. So once the pandemic is over, they would restart. What the charges would be at that point of time is not predictable. So I would be posting the website on our Instagram page of all the relevant sites you need to visit. In that, later on, you can go and search for the financial aspect of it. I hope you've got some idea of how to practice in Netherlands from this video. I'm Dr. Satish Kumar. This is Kaizen Dental. Our aim here is to help dentists succeed.